and all this. So I will take 2 minutes to talk about compounding pharmacy. How many of you know about compounding pharmacy except for Dr. Narjit? Have you heard about compounding pharmacies? So compounding pharmacies, what we used to do before, what our GPs do right now. They take half tablet, 1 tablet, this is compounding, right? Compounders used to do, dispensing of the drug. We have this word compounder. We have been using this term since very long. Compounders dispense the medication. We keep compounding in our clinical setup. When we add B complex in the dextrose, we add B complex. This is nothing but compounding. We are adding 2 things together to be delivered. So in the Western world and even some Southeast Asian countries, there is a lot being talked about the compounding pharmacies, and they claim that the compounding pharmacy people claim that we are giving you the natural product, so it will not have side effect. Wrong. Any product which is coming is natural. Even the raw material what they are getting for their estrogen progesterone is from the same factories from where the FDA approved drugs are being made. They don't cultivate the yam and the soya and the fenugreek in their own jungles, right? So I asked them, from where you get the raw material? They have no answer for that. Then they say that, okay, no, raw material is the same, but we have more, advanced raw material. We have better raw material. How can you say that? Have you checked it by FDA? Because they don't check it. But the manufacturing units do. They have that compulsion to check that. Then third point come. No. Raw material is same. What we use and what they use, it is the same. But you know what? We make the custom made. What do you mean by custom made? So what the physician tells us, we make that way. Okay, tell me, how does it help? So physician feels that the patient should be given 1 milligram per day. So we compound it as 1 milligram per milliliter and give it to the patient. Now how does it help? Well, it helps that when physician wants to change the dose, they can again call us and we will make the new dose regime. Okay, what usually is the dose? The usual dose is 0.5 milligram. And what is the usual dose what people give? 90%. It is 0.5 milligram to 1.5 milligram. So what happens if a patient is on 1 milligram per day and you have already delivered? After 10 days, doctor feels that the patient should take 1.5 milligram per day. So patient orders again and we get. So what about that prescription which was there? It is a waste. Now, why not patient do the very simple thing? Rather than taking 1 ml, why the patient cannot take 1.5 ml? Why to compound it again? So compounding pharmacies are doing nothing. Then who is checking your product, whether it contains estrogen or not, or progesterone or not? Are you giving it to any lab to check it as per the FDA recommendation? Because FDA has this regulation. Every drug has to be checked. A batch, 1 sample. No, we don't do it. Why? We have checked the raw material. When did the raw material arrive in your compounding pharmacy? 3 years back. What is the stability of that compound? These are all the problem with compounding pharmacies. Therefore, they consider me their enemy. And in India, compounding pharmacy is illegal, not allowed. Every product going out is a medicine. And now in the US, they are going to make even nutraceuticals as the medicine. They cannot escape FDA. Nutraceuticals also, vitamins and minerals also. They have already proposed it. So anything which is going to be used by a patient for the medicinal value is a medicine. It has to come under the drug law, and FDA has all the right to check, take the samples out of it and get it checked at the FDA approved laboratory to find whether it has got the product or not, which every manufacturing unit does. Compounding pharmacies across the globe don't do that.
But where is compounding pharmacy?
US.
Accepted?
Nowhere. US, there is a huge. So what the anti-aging societies, and there is a nexus between the anti-aging societies and the compounding pharmacy. They have made a nexus and they say that all other products are bad. Only what we are giving is good. And actually they are giving the same thing what is there available. Both are same. So therefore I asked them, I call everybody. I ask getting obsessive. So raw material is same in the manufacturing unit, and they are buying in quintals and they are buying in kgs. But they are responsible at every checkpoint, every entry and exit. They have a checkpoint. They have to give certificate of analysis. They have to go under FDA. They can be cracked down by FDA. Their product can be returned back if any. What about the compounding pharmacies? What about contamination? So therefore, in India, not allowed. It is, everything is running behind only one thing. And then व्हाट इज ईजियर वे? नो डिबेट. तो कंपाउंडिंग फार्मेसी ने क्या किया, हमने एक ग्रुप बनाया, अच्छा ठीक है मैं आपको देता हूँ, आपकी प्रैक्टिस बढ़ जाएगी, आपका प्रिस्क्रिप्शन बढ़ जाएगा, बहुत अच्छा लगेगा, और लोग आने लगे. यस, इट हैपेंड. द रीजन वॉज नॉट एकेडमिक, रीजन वॉज कमर्शियल. एंड देन अ होल ग्रुप, एंड फ्रॉम देयर दे आर सेइंग योर एस्ट्रोजन इज बैड, नॉट माइन, योर, मेरा तो कोई है ही नहीं, मीन्स एक्स कंपनी इज प्रोवाइडिंग दैट एस्ट्रोजन इज बैड, माइन इज गुड. भाई तुम्हारा भी माइक्रोनाइज्ड एस्ट्राडायोल है, इसका भी माइक्रोनाइज्ड एस्ट्राडायोल है, इसका तो एफडीए टेस्टेड है, अप्रूव्ड है, आपका तो एफडीए अप्रूव्ड भी नहीं है, तो विच कैन बी बेटर. भाई दोनों दे के देख लो, 2 महीने के बाद ब्लड टेस्ट कर लो पेशेंट का, दैट इज फेयर. आप कॉस्ट देख लो दोनों की, कंपेयर कर लो. और रही बात डोज मैनिपुलेशन की, तो भाई मुझको अगर 1 मिलीग्राम का 0.5 मिलीग्राम करना है, मैं बोलूँगा भाई यू टेक हाफ ml. I will not order for 1 more. But here to you are ordering again, you are making a big burden on the patient. Got it? इंडिया में तो हम गोली आधी कर देते हैं, हिंदुस्तान में तो गोली आधा कर देते हैं, इंजेक्शन का भी हाफ डोज निकाल लेते हैं. अच्छा एक काम करते हैं, 250 मिलीग्राम ही देना है यार, आधा ले लो. हमसे बड़ा कंपाउंडिंग मास्टर कौन है पूरी वर्ल्ड में? इंडियन से बड़ा, राइट? We are the compounding master of this world. We are the one who use the word compounder. Right? Got it?